ask unanimous consent that the following law clerk and intern from my office be granted floor privileges for the remainder of the Congress. Bessie Blackburn, Roswell Cole.
Without objection.
Thank you, Mr. President. I want to begin today by noting that it is D-Day. 79 years ago today, we had brave men that stormed the beaches at Normandy. There were Tennesseans among those, and Tennesseans have chosen to very selflessly serve this country. The volunteer state has a long and rich tradition of military service. They have fought in every major conflict in the history of our country, going all the way to the Revolutionary War. Even our moniker, the volunteer state, is a nod to that tradition. It was made famous by the 5,000 citizen soldiers of the Tennessee militia who left their families at the drop of a hat to protect our young nation during the War of 1812. We have a responsibility to care for the brave men and women who guarantee our freedom for future generations. As a member of the Senate Veterans Affairs Committee, I've spent the past few years watching various officials fail at this task, especially as it relates to making sure our veterans receive timely access to quality health care that they deserve. Despite increased facility staffing over the past several administrations, despite each administration pushing for internal process improvements and expanded community care and telehealth options, the VA still cannot manage to perform this one basic task, which is timely access to quality health care. There are examples of this. I know you have them in the state of Vermont. I have them in the state of Tennessee. And there is no better illustration of this than the VA facilities in Dover and Clarksville, Tennessee. Now, these are the only two VA facilities in Tennessee within 50 miles of Fort Campbell, which is the second largest Army installation in the mainland United States. It sits on the Tennessee-Kentucky border. Now, the Fort Campbell area is home not only to thousands of active duty service members, but thousands more veterans and their families live in this area. So you would think the VA would pay some special attention to this area. But of course, that is not the case. If veterans want to see a primary care provider at the VA, now this is a primary care provider. If these veterans in Tennessee want to see a primary care provider, then for the Clarksville facility, they have to wait 48 days and 76 days at Dover. Think about that. This is not anecdotal. Those are the actual numbers released by the VA at 11:30 this morning. We double-checked the numbers. Think about that. You've got a backache. You've got a cold. You have bad headaches. You have a hearing issue. You have a knee issue. Just to see the primary care physician, you will wait 76 days if you're going to the VA facility in Dover, Tennessee. Now, this is the reality for hundreds and thousands of our veterans across the country. It is absolutely unacceptable. Now, Congress has tried to intervene. The Veterans Community Care Program, which we established as part of the VA Mission Act, of 2018 allows veterans to seek care outside the VA when wait times at those facilities exceed certain benchmarks. The program has helped alleviate some of those wait times, but it is obvious there is still a lot of work that has got to be done on that. And here's the problem. The problem is that the VA has wrapped this program up in endless layers of red tape. It is obvious that VA employees and the union, I am sure, are not wanting individuals to get into community care. So what do? They try to make this program unacceptable. They don't want veterans into this program. Just take a look at all the hoops that a veteran's got to jump through before they can see a doctor. Look at this list. Bear in mind, as you look at this list, that we promised these veterans. It was part of the promise to them when they enlisted, when they raised their hand, when they took that oath, when they signed up to serve, to protect, to defend this nation and our freedom. But here's what they have to do. First of all, they've got to request the appointment. They can't just show up, say, I need to see a doctor. They've got to request it, and they have to wait for the VA to certify that they're eligible and to do an eligibility review. So they call, and they request the appointment, and the VA says, we're going to get back to you. First of all, we've got to verify your eligibility. So it goes into a stack of things to be done. So once the bureaucrats decide that they're going to move forward on that request, on that case, the veteran still has to wait for confirmation from the VA that they can indeed go see the doctor. Then they have to wait for the VA to prepare and review a referral for the primary care doctor. Only when that comes in can they finally schedule the appointment. But they're not done yet. There's still more. Before that veteran can see a doctor, they need an authorization letter from the VA in their hand, a paper copy of an authorization letter from the VA that they take to the VA. How ridiculous can this possibly be? And once they do finally see a doctor, they have to wait and hope the VA remembers to pay the bill. And heaven forbid that that veteran needs a follow-up appointment or another referral. This is why in Clarksville, Tennessee, all these steps, 48 days. Dover, Tennessee, 76 days. Some parts of the country, it's 100 days to see a primary care physician. This is a bureaucratic nightmare, and our nation's veterans deserve better than this. And if Secretary McDonough and his friends can't get the job done, then Congress is going to need to step in and intervene. That is why I reintroduced the Veterans Health Care Freedom Act, which would allow veterans to bypass the VA's bureaucracy and choose the care they want to receive. The bill creates a 3-year pilot program within the VA's Center for Innovation Care and Payment that will take the VA largely out of that referral process. The VA can test drive this program in at least 4 different veteran integrated service networks. Those are called VISNs. It would allow the veterans to find and schedule necessary appointments at non-VA medical facilities. In other words, Mr. President, if they want to go to a doctor in their hometown, if they want to go to a hospital in their hometown, if they're taking cancer treatment and they want to do that at the local hospital, let them do it and send the bill to the VA. Now, it would also require the VA to give veterans information about eligibility requirements, about cost-sharing treatments and providers, so that they've got the information they need right there at their fingertips to be able to make their decisions. Now, doing this would give the VA 4 years to figure this out, to run these pilot programs, and to figure out how to let veterans get the health care they need when they need it at the facility that is most convenient for them. Surely to goodness, the VA ought to be able to figure this out in 4 years. We really owe it to our veterans to get them the best care as quickly as possible. If we want to do that, we have to put more power into their hands. Give them the information, the choice, the options. The bureaucrats have proven to us time and time again that they're just not going to make this easy. They are not going to make it simple for a veteran to access community care. And in Tennessee, Mr. President, I hear from veterans all the time. They're a 2-hour, a 3-hour drive away from the VA facility. Somebody's got to take off work and drive them to the appointments. Somebody's got to take off work when they have to go back for the referral. Let's let them go in their home communities where they can access the care that they need. I am so committed to continuing to work on this to solve this problem for our nation's veterans. I'm working with Chairman Tester, Ranking Member Moran, and my colleagues on the Senate Veterans Affairs Committee so that we can make good on the promises that we have made to our veterans. It's time to stop the false promises to the men and women who have served this nation. I would ask each member of this chamber for their support in bringing the Veterans Healthcare Freedom Act in front of the full committee for consideration. I yield the floor.